In the realm of cardiovascular health, where every heartbeat matters, the battle against heart failure takes center stage. As medical science continues its relentless march forward, an array of medications has emerged as potent tools in the fight against this condition. From easing the strain on the heart to improving its pumping efficiency, these medications are vital in enhancing the quality of life for those grappling with heart failure. In this video, we delve into the top 10 medications used in the United States to treat heart failure. Disclaimer: the information provided in this video is for educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have watched in this video. Heart failure, a formidable adversary of cardiovascular health, unfurls an array of subtle yet debilitating symptoms. Often marked by fatigue that clings to even the simplest of tasks, it begets breathlessness, like a relentless weight upon the chest, stealing the ease of every inhale. Fluid accumulates in the extremities and lungs, prompting persistent coughs reminiscent of drowning whispers. The heart's rhythm falters, leading to palpitations that remind one of their fragile mortality. Edema swells ankles and abdomen, a silent protest against the heart's diminished prowess. In the midst of this intricate constellation of discomfort, heart failure serves as a potent reminder of the body's intricate dance and its vulnerability to the passage of time. Let's take a look on the top 10 medications to treat heart failure. Number 10. Angiotensin converting enzymes or ACE inhibitors. These medications, like lisinopril and enalapril, work by dilating blood vessels and reducing the heart's workload. They block the conversion of angiotensin 1 to angiotensin 2, a hormone that constricts blood vessels. ACE inhibitors are added to heart failure regimens to improve symptoms and decrease the risk of hospitalization. Typical adult dosages range from 2.5 to 20 milligrams once daily. These medications are usually taken orally with or without food. Possible side effects include a persistent cough, elevated blood potassium levels, and dizziness. Number 9. Beta blockers. Beta blockers such as metoprolol and carvedilol target the heart's beta receptors, slowing down the heart rate and reducing its workload. These are crucial additions to heart failure treatment due to their ability to improve heart function and prolong survival. Adults commonly start with a low dose, gradually increasing it to the target dose. These medications are typically taken orally, with or without food. Potential side effects encompass fatigue, low blood pressure, and slow heart rate. Number 8. Angiotensin receptor blockers or ARBs. Medications like losartan and valsartan fall under this category. ARBs work by blocking the effects of angiotensin 2, resulting in vasodilation and reduced blood pressure. They are prescribed when ACE inhibitors cause intolerable side effects. Normal dosages range from 25 to 100 milligrams daily. They can be taken with or without food. Side effects mirror those of ACE inhibitors, including dizziness and elevated blood potassium levels. Number 7. Diuretics. Diuretics like furosemide and hydrochlorothiazide aid in eliminating excess fluid and salt from the body, thus reducing the heart's workload. They are added to alleviate fluid retention and shortness of breath. Dosages vary widely based on the specific diuretic and patient needs. Diuretics are taken orally, usually in the morning, to prevent nighttime trips to the bathroom. Possible side effects include dehydration, electrolyte imbalances, and increased urination frequency. If you have questions about your medication, we created a book just for you. 10 questions everyone should ask their pharmacist. Link down in the description below. Please check them out. Number 6. Aldosterone antagonists. Spironolactone and aprenolone are examples of aldosterone antagonists. These medications block the effects of aldosterone, a hormone that contributes to fluid retention and remodeling of the heart. They are used to manage advanced heart failure and increase mortality rates. Adult dosages usually range from 12.5 to 50 milligrams daily. These medications are taken orally, and individuals should be monitored for elevated blood potassium levels and kidney function. Number 5. Hydralazine and isosorbide dinitrate. Hydralazine is a vasodilator that relaxes blood vessels, while isosorbate dinitrate relaxes veins and reduces the heart's workload. This combination is used predominantly in patients who cannot tolerate ACE inhibitors or ARBs. Dosages vary, but they are usually taken 2 to 4 times a day. Potential side effects include headaches, dizziness, and flushing. Number 4. Digitalis or digoxin. Digoxin enhances the heart's pumping ability by increasing calcium levels in heart cells. It's often added to control heart rate and improve symptoms in heart failure patients. The normal dosage is usually between 125 to 250 microgram daily. It can be taken with or without food. Side effects include nausea, vomiting, and arrhythmias. Number 3. Sacubitril or valsartan, ARNI. ARNI is like sacubitril or valsartan combine an angiotensin receptor blocker with a neprilysin inhibitor. This dual action helps dilate blood vessels and reduce strain on the heart. ARNIs are used as an alternative to ACE inhibitors or ARBs in certain cases. The usual dosage is 97 over 103 milligrams twice daily. It's taken with or without food. Side effects include hypotension, elevated blood potassium levels, and kidney impairment. Number 2. Ivabradine. Ivabradine reduces the heart rate by selectively inhibiting the channels in the sinoatrial node. It's employed to manage heart failure with reduced ejection fraction and elevated heart rates. The standard dosage is 5 to 7.5 milligrams twice daily with food. Potential side effects encompasses bradycardia, hypertension, and luminous phenomena or visual brightness. Number 1. Entresto. Entresto is an innovative medication combining sacubitril and neprilysin inhibitor and valsartan, an angiotensin receptor blocker. It's a significant addition to heart failure treatment as it improves heart function and decreases the risk of hospitalization. Dosages usually start at 95 over 51 milligrams twice daily and can be taken with or without food. Common side effects include hypotension, elevated blood potassium levels, and impaired kidney function. From ACE inhibitors and beta blockers that soothe the heart's rhythm to diuretics that relieve its burden, each medication contributes a unique note to the orchestration of healing. It is important to remember that while these medications hold the potential to transform the lives of heart failure patients, their usage should always be under the careful guidance of a medical professional. Through the mastery of science and the compassion of caregivers, the melody of hope continues to play for hearts in need. For a more comprehensive understanding of this topic, please see the description box. We provide a list of the top 10 questions to ask your pharmacist when picking up your medication. This is not an all-inclusive list, and if you need more information, check out the link below. Welcome to Dr. Vivian Medications and Natural Supplements. Our channel is dedicated to providing valuable information on health and wellness that's made by a licensed professional. Times are crazy, and it's extremely important to be well-informed and taking care of yourself. If you enjoyed watching, please help us out by liking this video. In this way, we will know how well we're doing. And if you like more of these, consider subscribing and hit the bell notification to stay on top of for more upcoming videos. Thanks for watching.